Hello everyone. Now we are going to discuss about the intracellular accumulation. In metabolic derangements in cells, there could be intracellular accumulation of substances, either cytoplasmic or nuclear. There are four main types of mechanism responsible for intracellular accumulation. First is inadequate removal of normal substance due to defect in packaging and transport, which is seen in steatosis or fatty liver in liver cells. The second mechanism is accumulation of and endogenous substance as a result of genetic or acquired defect in folding, packaging, transport and secretion. This is seen in alpha 1 antitrypsin mutated forms. Third mechanism is failure to degrade a metabolite due to inherited enzyme deficiency, which is seen in lysosomal storage diseases. Fourth mechanism is accumulation of abnormal exogenous substances, for example carbon or silica particles. Inherited cellular accumulations by the time result into the cell injury. This is the diagrammatic representation of all the four mechanisms. Normal cells, due to abnormal metabolism, there is accumulation of intracellular fat in fatty liver. In the second mechanism, defect in protein folding and transport result into the accumulation of abnormal proteins. In the third mechanism, lack of enzyme, which is responsible for the degradation of the complex substances, which is seen in lysosomal storage diseases. And the fourth mechanism is ingestion of an exogenous substance. Now we will see them one by one. Lipid accumulation. All the major classes of lipid accumulate in cells, namely triglyceride, cholesterol, phospholipids. Fatty change, also known as steatosis. Abnormal accumulation of triglyceride in liver parenchymal cells is known as fatty liver. Fatty changes can be seen in other cells of our body, like in cells of heart, muscles and kidney. Causes of these fatty changes are maybe exposure to the toxin, protein malnutrition, diabetes mellitus, obesity and anoxia. Cholesterol and cholesterol esters. Accumulation of cholesterol esters are seen in so many examples like atherosclerosis, xanthoma, cholesterolosis and Niemann-Pick type C, disease type C. So first we will see atherosclerosis, in which accumulation of lipid vacuoles filled macrophages or smooth muscle cells are seen in the intimal layer of the arteries. In xanthoma, there are clusters of foamy macrophages seen in subepithelial connective tissue of skin and tendons in hyperlipidemic individual. Cholesterolosis, focal accumulation of cholesterol laden macrophages in the lamina propria of the gallbladder. Niemann-Pick disease type C, it's example of lysosomal storage diseases, in which there is a cholesterol trafficking seen due to the mutation in enzyme. This is the microscopic image of the fatty liver. These are the large vacuoles clear vacuoles of lipid. This is the example of cholesterolosis. These are the focal accumulation of foamy macrophages in gallbladder. Now we will see the accumulation of proteins. Reabsorption droplets in proximal convoluted tube. In proteinuria, there is increased protein reabsorption which is result into the pink hyaline droplet in proximal convoluted tube. Normally secreted proteins, when secreted in excess amount, this will result into accumulation, like Russell body in plasma cells in multiple myeloma. These Russell bodies are distended endoplasmic reticulum with protein accumulation, defective intracellular transport and secretion of critical proteins. Due to slow folding, there is a buildup of partially folded proteins, result into the endoplasmic reticulum stress and apoptosis. Accumulation of cytoskeletal proteins like microtubules, actin, myosin, intermediate filaments, alcoholic hyaline in liver, neurofibrillary tangles in Alzheimer's disease. Intermediate filaments are of so many types like keratin, neurofilaments, desmin, biomentin and glial filaments. There is an aggregation of abnormal proteins in amyloidosis. There is a condition known as hyaline changes. Histologically, a homogeneous glassy pink color is known as hyaline changes. As accumulation of glycogen is seen in glycogen storage diseases that we will discuss in detail later on. There are some pigments. They can also be deposited intracellularly. Exogenous carbon in anthracosis. Endogenously, lipofuscin or lipochrome pigment, which is brown in color and also known as a beer and tear pigment. Polyunsaturated lipids after lipid peroxidation result into the lipofuscin formation, and this is a telltale sign of free radical injury and lipid peroxidation. Other endogenous pigments are melanin and hemocyanin. Thank you.